What are some of the main symptoms of mold toxicity, and how do you tell that that's specifically mold toxicity and not a bacterial infection or a viral problem or an autoimmune problem?
Yeah, that's the big dilemma. I can give you kind of the main picture of someone who's been sick from mold, and you can get sick from just the toxins. So if that mold is behind building materials, the toxins come right through the building materials. It comes through insulation, drywall, flooring, anything. It can come right through those because they're ultra small. Some people are also exposed to the spore, so they're going to have spore-based kind of allergies, asthma, hay fever, that kind of thing. So that's what we kind of define as mold illness, is mold allergy. But I am on a mission to expand that definition to mold toxicity, to get those mycotoxins in there. Because in my personal practice, probably 75% of the people I'm seeing are mycotoxic, not mold allergic. So, so the symptoms then can be spore-based, like I just said, hay fever, sinusitis, sore throat, postnasal drip, asthma, allergies, that kind of look. The other 70-ish% is going to be toxin-based, and these toxins are nerve toxic, they're immune toxic, they're toxic to our gut lining, our skin, to our genes, and to our brain and nervous system. So now that I've said that, you can imagine it could create almost any symptom in the body, depending on what your pre-existing Achilles heel is, so to speak.
Yeah.
But the most common is fatigue. And that can look like debilitating fatigue, or that can look like somebody who's an athlete who has a low VO2 max. So it just depends on where we're starting from on that when they begin to be exposed to the mold. But people generally describe just a level of things are a little harder than they should be, or than they used to be before they took that new job or moved into that new apartment or whatever. So fatigue is a big one. Also, anxiousness. So I don't think I have had any patient, and I'm scanning in my mind right now, that hasn't reported some sort of internal angst. And it's not necessarily, I'm careful not to say anxiety, because that conjures up like anxiety disorders and, needing medication and that kind of thing. Certainly that can happen. But it's more of, it can even be subtle. It can be an inner sense of unrest, an inner sense that things aren't okay. And that's because things aren't okay. You're breathing a poison, So it's your body being really smart. Gut problems are very, very common. So having like a irritable bowel syndrome, alternating constipation, diarrhea, constipation, bloating, sort of a candida overgrowth look. A lot of people that are mold toxic do also get candida overgrowth because the body is now sort of having an over fungal burden. So it can't control the other fungi in the body and keep them in check.
That's so gross.
Yeah. And then you might see skin rashes. So let's see, gut, skin, brain, anxious, foggy mind, brain fog, and then frequent infections. So even if you're not exposed to spores, these are going to be the people that once they get a cold, even if they're not dealing with like postnasal drip all the time or sinusitis all the time, they get colds a lot. And when they do, they tend to either linger or turn into bacterial infections, or like a chronic bacterial vaginosis or a chronic UTI. Some of the oddities of mold are ear ringing. And if you think about that, one of the main drug classifications that causes ear ringing is antibiotics. And a lot of antibiotics are mold toxin. Their penicillium, the species of mold, makes penicillin, the mycotoxin. So, that makes sense that a lot of people will feel like they have a lot of ear ringing when they're in their mold exposure. And that can be the hardest one to actually cure. That usually is a lingering symptom for people somewhat. Yeah. And the other one is interstitial cystitis. That's another oddity. Pelvic pain, pelvic region pain. Then I go looking at mold. But as I'm saying these things, you're thinking, well, it could be anything. Yeah, it could be adrenal fatigue, food allergies, Lyme disease, all these things. So in practice, I created a questionnaire because I was seeing a lot of Lyme disease patients and I was having a hard time. They both look so similar. I couldn't tell, to save time, so that we didn't have to go down the track of treat everybody for Lyme, and then if they didn't get better, now treat them for mold.
So that sounds brutal.
Yeah. So I tried to create this clinical questionnaire that started to discern which of those symptoms are more mold and which of those symptoms are more Lyme. And Dr. Horowitz, Richard Horowitz, who's a genius and one of our Lyme experts, has been able to identify that Lyme has migration. So there's going to be a joint pain of your right knee, and then it's your first finger on the left side. You know, I mean, it can migrate all over. That's kind of a keynote for Lyme. Mold doesn't do that. So I took that off the questionnaire, and then I created my own questionnaire that gives you sort of a score. So if anybody is interested in that, I have that. If you're a practitioner listening, I have that questionnaire. They can just email me through my website, and they can get that questionnaire to start using in clinic, because it really saves you time. It just gets down to, okay, it gives you a score of nope, not mold, possibly mold, probable mold. So which way is that needle moving? And then you can further investigate with testing and things like that.